It is time this morning to check in with Dr. Art Mollen like we always do on Sunday. And first, Dr. Art, you've got the Mollen Minute for us. Good morning.
Exactly. Good morning to you. And Maricopa County has seen one of the greatest number and increases of COVID-19 with about 9,000 cases a day. So that is significant. It's a positivity rate of about 20%. And Arizona is one of the worst states for administering the number of doses that have been delivered, administering only about 30% of the vaccines available. And the new CDC guidelines have lowered the age criteria for COVID vaccinations from 75 to 65. The new variant strain of the COVID virus is more contagious and highly transmissible, and they're suggesting that it could become the dominant strain by March, causing huge spikes in the number of COVID cases. However, the present vaccines appear to be effective against this new variant strain, and if you contract COVID, it will provide you with a natural immunity of at least 83%, and that could last up to 6 months. But don't lower your guard once you receive a vaccine, as you're not fully protected and you could still pass COVID on to someone else. Finally, if you're exposed to someone who developed COVID, your symptoms could appear between 2 to 14 days later. And that's your Mollen Minute of the morning, Kylie.
Dr. Art, a few questions before we send it to break. Do you think that UK variant is in Arizona right now?
I do believe that the variant is, again, probably in Arizona. We may not have definitively diagnosed it as the variant, but I do believe it, especially based upon a lot of the cases that we're seeing. So yes, I believe that we probably will see that turn up, whether it's in the next couple weeks or over the next month. Yes.
One more question before we go. Does that mean that you think that cases are going to continue to climb? At what point do you think we'll see things plateau and start to come down as more people get vaccinated?
Yeah, well, there's no question about it. We're going to see a huge spike, and that's going to continue probably into March and hopefully not into April. I think we'll start to slow down once we get into the summer months, but it's going to take us quite a while for this. I think what's important for people to understand is if they do get vaccinated, it's going to take about 12 days before their body is actually producing those antibodies to protect them. So you have to keep your guard up, wear your mask, make sure that you're not transmitting it to someone else. You could potentially even be a carrier, even though you have received the vaccination. So let's go forward and be positive about what's going to happen down the road. Get everybody vaccinated.
We have been talking with Dr. Art Mollen about the COVID-19 vaccine. Many people are starting to get the vaccine. And Doc, good morning to you.
Good morning.
Tell me about the vaccine. When we get our one shot, do we need to get the same brand when we get that second dose?
Well, you know, that's an interesting question, and it's probably hasn't been fully addressed, but I would believe that you should get the second shot from whomever you received the first shot. So if you got the Pfizer vaccine, you're going to have to stick with that. If you got the Moderna vaccine, you're going to have to stick with that. So I think that probably is a great question, and it's unanswered at this point, but based upon the CDC protocol for these vaccines, when they get approved, you actually have to stick with the same manufacturer for the second dose. The other thing is the United Kingdom has basically scaled back, and they have suggested that you can actually wait up to 12 weeks to get that second shot. So what they're trying to do is roll out the vaccine, again, because it's limited, give as many people that first shot so they get a certain amount of protection. The Pfizer vaccine protects you for about 52% after one shot. Moderna's vaccine protects you about 80%, they say, after the first shot. So you may not have to necessarily go within those guidelines, and we're suggesting Pfizer vaccine, the second shot at 3 weeks, the Moderna vaccine at 4 weeks later. So there's some interesting questions that are probably completely unanswered, Jamie.
Now, with this vaccine, many of us have been getting the flu shot vaccine every single year, but yet sometimes we still get the flu. Can we still get COVID-19 if we've had the 2 doses of the vaccine?
Yes, you can still get it because it's only, it's suggested that it's only 95% protective. But if you were to contract the COVID, it's also been suggested that you probably would have less complications and a less serious infection than some people who had not received any of the vaccines. So on all of these vaccines, there's always the potential, for someone to still contract the disease. It's not 100% protective.
Folks are trying to do whatever they can to make it to that vaccination point. Some people are wearing 2 masks. They're double masking. Does this do anything? Does this help protect us?
Yeah. So if you start wearing 2 masks, it could become difficult to breathe. So I think wearing 1 mask, you might want to wear a shield with it. The other thing is if you're going to make a home mask, and I have something here, which is basically a vacuum cleaner bag. And so it's suggested if you're making a home mask, use this because the filters in these home masks, this would be very, very protective. So you could have a mask, you use a layer of the filter, and what the filter basically does is it's actually protecting the people around you from contracting COVID if you happen to have the COVID. So for you, it's not necessarily going to give you that increased protection, but it will protect other people. So are 2 masks a good idea? Well, I'd suggest maybe getting a shield along with the mask instead. Jamie.
Doc, we've got 30 seconds left. In the medical community, what are people saying? When are we going to get out of this thing? We've got people who've had it. We've got people who are getting the vaccine. At what point does it level out?
Well, it will level out, but again, we don't have that answer either. Again, we're looking at March as probably another COVID variant coming to its peak in particularly Arizona. I think what people have to understand is that these vaccines are protective, but if people don't get the shot and we don't get to a point where we have a herd immunity, which is again 90%, and that comes from either people receiving the shot or people actually contracting the disease, we're not going to get to the point where we can be a little more cavalier about this. And so going forward, again, we're going to have to do the social distancing, wear the mask, and make sure that we're washing our hands on a regular basis. So I think at the end of the day, we're probably going to look forward towards the end of this year, 2021, before we can get back to some type of normalcy. So
we may be able to see the finish line.
Unfortunately,
but it is still far out in the distance,
yes.
So hang tight. Doc, thank you so much for your
Yes.
time. We appreciate you,
Yeah.
as always, every
You're
single
welcome.
Sunday. Thanks, Doc.